Hello, everyone. My name is Rutendo Roslyn Kandawashika, and I'm excited today to share with you my Women Lift Health Leadership Journey project. It is entitled Assessing Africa CDC's Leadership in Catalyzing Institutional Change for Gender Equity in Leadership. This project is very close to my heart because it speaks to leadership systems and lived experiences by the women in public health in Africa. I am a public health practitioner and I'm currently serving as a senior partnership officer with the Africa Centers for Disease Control and Prevention. I'm from Zimbabwe and working at continental level and navigating leadership spaces as a woman has shaped how I view power, opportunity, and inclusion. So what exactly is this project about? At the core, this project looks at how the leadership at Africa CDC is actively driving institutional change towards gender equitable leadership. We are documenting what is working, what is holding us back, and what can be scaled so that more and more women are represented and influential at senior decision-making spaces. The why about this project is very clear. Women make the backbone of the public health workforce, but unfortunately, they are underrepresented at senior level. We realize that more and more as we move up the ladder, there are lesser women in leadership. Coming closer to home, currently at the Africa Centers for Disease Control and Prevention, women make up about 35% of the workforce. Only 8 out of the 28 heads of divisions and directors are women. While this may seem low, this actually signifies the commitment from the current leadership at Africa CDC, as there have previously been no female directors. The how for this project: I took a systematic approach, firstly assessing the leadership impact to really look at how the leadership at Africa CDC is influencing gender equity in leadership. Also looked at identifying enablers and barriers and documenting and scaling what is working, as well as generating strategic recommendations and promoting knowledge sharing across institutions. I am pleased to share with you the progress and the early results. To date, we have managed to hold 2 gender-responsive leadership trainings, which were aimed at building foundational awareness, skills, and commitment across participants at Africa CDC. We've also developed a gender assessment tool that is going to be rolled out in order to identify the gaps and the areas that we can focus on. We've also managed to forge strategic engagements, strategic partnerships with women in global health, and we are also actively working with the AU Gender Equity and Women's Empowerment Directorate. We have also managed to identify and engage male allies in order to sustain this work. We are also working on establishing a technical working group that is also going to give oversight and ensure sustainability of the efforts. The next phase of this project is very exciting as we are now going to be getting into the action. We're going to be rolling out the assessments, to be analyzing the findings, documenting the enablers and barriers, as well as looking at the success models. We're going to be actively engaging with the male allies and operationalizing the technical working group, as well as formulating strategic recommendations. Throughout this project, I have been guided by the pillars of the leadership journey. Firstly, authentic leadership. This project is deeply grounded in lived experiences. And then I also looked at inclusive leadership, bringing others into the change process. Strategic leadership, driving systems level change. Impactful leadership, turning vision into action. In conclusion, this project is not just about numbers or representation. It is about transformation, shifting power intentionally, as well as making sure that women's leadership in African institutions is not exceptional, but a norm. Thank you.